If you suffer from back pain or sciatica that gets worse the longer you're on your feet, then you may benefit from spinal decompression. Now, sure, you could go to a chiropractor and pay hundreds or even thousands of dollars for spinal decompression therapy, but there are some simple, easy, and free ways that you can decompress your spine at home. In this video, I'll show you 7 ways to decompress your spine without having to go to the chiropractor. But first, who would benefit the most from spinal decompression? Well, any type of back problem that gets worse the longer you're upright can benefit from spinal decompression. Gravity slowly compresses down on your spine all day long, and that can put pressure on your joints, your discs, and your nerves. But fortunately, there are some easy ways to decompress your spine, and one of those ways is just lying down. When you lie down, your spine moves into a horizontal position, but gravity is still compressing vertically. Therefore, that immediately removes the gravitational compression. Now, when you're in this position, it often helps to lie in a hook lying position like this with your hips and knees positioned at roughly 90 degrees. That helps relax the muscles in your lower back and allow your spine to flatten down into the floor. Now, if you have trouble getting down on the floor, you can also do this lying with your legs over the edge of the couch or lying in bed with a bolster underneath your legs. So that's the first way to decompress your spine. The next way, we're going to add just a little bit to that. We're going to move with the legs up on the wall. And it is probably a good idea to take your shoes off so you don't mark up the wall. Try to move as close to the wall as possible. Now, note if you pull your toes up like this, or down, I guess, this puts more tension on your sciatic nerve. So allow your toes to kind of point out that way. That takes pressure off of your sciatic nerve. Then kind of push your legs up the wall a little bit and scoot a little bit closer. Then allow your back to relax down. That tension of your heels kind of grabbing onto the wall and then your spine sinking down allows you to apply a little bit further decompression to your lower back. Again, just sit here and take some deep breaths. And allow your back to sink into the floor, applying a gentle traction to your lower back. Hold this for 3 to 5 minutes, or as long as you feel comfortable doing so. For the next version, we're going to use a bed. For this one, you'll lie over the side of your bed so that your feet are on the floor. Lie with your belly flat on the bed like this, and your waist right at the edge of the bed. Then allow your knees to bend slightly so you take the pressure off of your legs and your lower body is basically hanging from the bed here. This uses gravity to pull your legs down, but your spine is still horizontal. And so this gives you a decompression force, particularly at the lower levels of your spine at L4, L5, and L5, S1. Which is usually the place where most people have back problems anyway. The next method will be grabbing onto something heavy and leaning back. I know many patients that do this with a kitchen counter, but just grab onto something that's not going to move and then lean back this way. So you're kind of putting your pressure on your heels, allow your knees to bend a little bit, or for some people, they even feel it comfortable to squat down like that. But do what feels comfortable for you. If you find it easier just to stand and lean back this way, and this gives you more relief, do this. If you feel it's a little easier to squat down, that does round out your lower back, but you also have to be mindful of your knees. You can also do the same thing on a doorknob, but make sure the doorknob is firmly attached, and also make sure that you're pulling the door closed, not pulling the door open like this. But if you do have the door open, another way that you can do decompression at home is hanging over top of the door. You do probably want to keep your toes on the floor, but reach over top of the door frame, and then just allow your knees to bend and allow your body to sag. This uses gravity again to decompress your spine, pulling your lower body down while you're keeping your upper body held up using the door. Hold this for as long as you can comfortably. Your grip will probably be the thing that fails first. Similarly, you can also do spinal decompression hanging from a pull-up bar. This one obviously does require a little bit of equipment, but you can buy pull-up bars that you hang in a door frame relatively inexpensively, or if you belong to a gym or have a home gym, you can use that to hang from the pull-up bar. Now note that your grip again will probably fail first when doing this, and for some people it may not be comfortable at a dead hang like this. So you can either keep your toes on the floor, or what I find works better for a lot of people, especially people with spinal stenosis or degenerative disc disease, is actually putting your feet out in front of you or propping them up on a chair. This puts your spine in a little bit of a flexion position where it's not extended out straight like that. You're at a little bit of a bend. That further opens up the spaces between your joints and where the nerves come out. So just walk your feet out there. That'll also probably allow you to hang for a little bit longer while putting your spine in a better position. Now, if you found that some of those other forms of spinal decompression help you, but you'd like to be able to do it for longer, you might consider investing in an inversion table. When you use an inversion table, gravity turns you upside down like this, again, helping you to decompress. Now, many people think of inversion as going all the way up and down, but with an inversion table, you can kind of control at what angle you want to decompress. So you can go anywhere from a straight horizontal all the way down to completely upside down. Now I'm tethered in here, so I can't go any farther than 60 degrees, but if you would like to go all the way back, you can certainly do that. To come back up, you just bring your arms down to your side and you're back to an upright position. If you'd like to learn more about inversion tables, I'll link to a video about them in the end screen of this video. So those were 7 ways to decompress your spine at home. Now the good news is they're easy to do. You can do them pretty much anywhere. They work fast, and most of them are free or relatively inexpensive. The bad news is they are usually temporary fixes because you're always fighting that compressive force of gravity. But think about it. Gravity has been there your entire life, and for most of it, it probably wasn't a problem. So in order to fix your back pain or sciatica over the long term, you need to find the reason why that gravitational force has now become a problem. One way you can do that is checking out my book, The Over 50 Sciatica Solution. Or you can check out the back pain and sciatica playlist on this channel right here. Thanks for watching, and I'll see you in the next video.